Great. Good morning, and thank you all for being here. My name is Dr. Chan. I am the state epidemiologist at the New Hampshire Department of Health and Human Services. As Commissioner Chivinette just mentioned, we announced last night two new presumptive positive cases of COVID-19 in New Hampshire. I do want to take a brief step back and just summarize what has happened in the last week. As I'm sure many of you are aware, our state public health laboratories brought on COVID-19 testing. Over the last week, we have tested over 40 individuals in our public health laboratories for this new disease. About half of those tests were conducted yesterday. So we are certainly ramping up testing in our public health laboratories, and we can certainly expect further testing to be conducted in the coming days and weeks, and potentially even additional positive tests. I also want to mention that the initial two presumptive positive cases identified in New Hampshire over the last week or two have been confirmed at the Centers for Disease Control and Prevention as positive for COVID-19. So currently, with the two new additional presumptive positive cases we announced last night, there are a total of 4 individuals in New Hampshire who have tested positive for COVID-19. These new cases obviously broaden our public health investigation, and our public health team is working very hard to try and prevent further transmission in our communities. It's important for anybody in our communities in New Hampshire and surrounding to take precautions, especially this time of year, to prevent further transmission of not only COVID-19, but many other viruses like influenza, which are circulating in our communities. This includes staying home, even if someone is only experiencing mild flu-like illness, certainly if they're experiencing fever or any respiratory symptoms. We will continue to work with our hospitals and local community partners to identify rapidly and isolate and investigate anybody suspected of having COVID-19. So regarding the announcement last night of our 2 new presumptive positive COVID-19 cases, I want to give a little bit more detail. One individual is an adult male from Rockingham County who traveled to Italy and returned and has now tested positive in our public health laboratories for COVID-19. This individual, it's our understanding, they were staying at home in the several days before testing positive. So while we are investigating, we believe that the exposure to the community overall is low at this time. But certainly we will be investigating and release more information when we have it. The second individual was an adult male from Grafton County who we believe was exposed to COVID-19 virus at a church service about 1 week ago on Sunday, March 1st. As mentioned, we are actively conducting investigations on both individuals, but both individuals are currently isolated at home, as are their close household contacts, and they do not currently pose a risk to public health. Regarding the situation of the individual from Grafton County with a potential exposure at church, we have been working with the pastor of the church community to notify members of that church. We ask that anybody that attended the church service on Sunday, March 1st, and either attended the coffee social at 9 a.m. or the worship service at 10 a.m. At the Hope Bible Fellowship Church in West Lebanon to stay at home and not go out in public, especially as we are conducting our public health investigation. We also want to make people aware that if they attended one of these functions and are symptomatic with either fever or respiratory illness or early symptoms of a flu-like illness, that they contact the public health department here and talk with one of our public health nurses. The number that people can call is 603-271-4496. We believe our most recent case of the adult from Grafton County was exposed to the COVID-19 virus during the church service on March 1st from another individual who shortly after the church service developed symptoms of COVID-19 and underwent testing. So we have been in very close communication with the church pastor. The church has acted appropriately. Sorry, just pausing there for a minute because there's some background noise on the phone. The church and the church pastor and church leadership has gone above and beyond to protect the community by proactively canceling the church services for this morning and functions this coming week. That action was taken even before our positive test results yesterday. when the church leadership knew that we were investigating and potentially testing someone with symptoms from their community. We will provide further information as we investigate, especially if there are additional settings that need public notification. So these new positive detections, we know, will obviously raise concern within the communities, especially given the expanding global epidemic of COVID-19 and the increasing number of individuals in the United States as a whole with identification of COVID-19. I do want to highlight a few things. We know that this virus can spread very easily from person to person, and we know that it primarily spreads through respiratory droplets from a person who is infected with the virus. So that can include spread through coughing and sneezing, for examples, from someone who is symptomatic. This is very similar to how influenza is spread every year. We also know that people can spread this virus very early in the course of their illness, when symptoms may be mild, even before fever develops. So individuals that may begin to feel fatigued or have muscle aches and begin to feel unwell, it is possible for these individuals to spread the virus if they are infected with COVID-19. We also know that from case reports in the scientific literature that spread is possible even in the hours before symptoms may become readily apparent to individuals. As we have heard from our federal partners, however, the primary driver of this global epidemic and the primary driver of spread of this virus in our communities will be from people who are infected with COVID-19 and symptomatic with the disease. Because of the way this virus spreads and how easily it can spread person to person, I want to emphasize some precautions that people in our communities can take. This includes staying home if someone is feeling ill, frequent washing of hands, covering coughs and sneezes, frequent disinfection of frequently touched surfaces like doorknobs and other objects, and finally, social distancing. So avoiding close contact with individuals who are sick and potentially coughing. Again, I want to emphasize that this is a virus that is spread primarily through close contact that's within 6 feet or less of someone who is symptomatic and showing symptoms of COVID-19. We are, again, I just want to emphasize, actively investigating these 2 new presumptive positive cases. The specimens will be sent to the Centers for Disease Control and Prevention for confirmation testing, but we are not waiting on that confirmation testing to act and conduct our contact investigation. We will be reaching out to individuals who we identify as close contacts and asking them to self-quarantine at home and monitor for symptoms, and we will share additional information as we have it in the coming days. I want to turn things over to Beth Daly, who's the chief of our Bureau of Infectious Diseases and is helping to lead our investigation efforts into COVID-19, and then we'll take questions. Thank you.
Thank you, Dr. Chan. Good morning, everyone. Again, I'm Beth Daly, D-A-L-Y. I'm the Bureau Chief for Infectious Disease Control here at the department. I'm also serving as our incident commander overseeing our COVID-19 response. I just wanted to provide a few comments in regards to our preparedness and response activities here in the state. In particular, I just wanted to let you all know that the department and our healthcare providers have been preparing for many years to be able to respond to viruses such as this COVID-19. We've been working on influenza preparedness activities, which are readily adaptable to the situation that is before us. Among our most important activities has been to ensure our state's capacity to identify a suspected case. This involves communicating with our healthcare providers and making sure that they have the capacity to identify a suspected case, isolate that individual appropriately, and then to inform our department. And this system is clearly working. We do maintain a 24/7 phone line to receive these reports of suspected cases, and Dr. Chan provided that phone number. In addition to the health alerts that we have been providing to our healthcare partners to keep them informed, we have also issued written guidance for a number of different organization types. And I wanted to draw your attention to our guidance for businesses and other organizations. This guidance in particular highlights the importance for businesses to make sure that their employees who are sick stay home and do not report to work. Again, our 24/7 phone line is available also to business organizations who may have questions about how to implement this guidance, as well as the public, and we can answer general questions around that. We've also been working with our partners to plan for community transmission here in New Hampshire, and we've been maintaining regular communications with our federal and local partners as well here, and as well as our state agencies. Finally, because there's no vaccine available to prevent this virus, we need to remember that our most important measure right now are the personal prevention measures that Dr. Chan outlined for us already, and so it's critical that our people here in New Hampshire take these measures very seriously. Thank you. We're happy to take questions.
Jake, do you want to?
Yep. Good morning, this is Jake Leon again. We will take questions from the media assembled in the room just because it's easiest to see them, and then we'll do our best to comb through in an orderly fashion everyone who's on the phone. Go ahead, Dr. Chan.
Questions? Yes, sir.
So two quick questions. First off, on the new Grafton County person, did that person contract it from the person who went to the private event and didn't self-isolate, or is this the second person who contracted it from the person who didn't self-isolate? That's the first question.
Yeah, so the question was, which individual did this church member contract the virus from? We do not believe, so this individual did not contract it during the event in the White River Junction function room. I can say that. It would be the second individual.
Okay, thank you. And is it Ms. or Mrs. Daly? Is it Ms. or Mrs.?
You can say MS.
Oh,
Ms.
okay, thank you, Ms. Daly.
Mhm.
Or Dr. Chan, can one of you take a minute and walk through the investigatory process to say, okay, say I'm infected, I work at an insurance company, do you start talking to all my coworkers, do they start talking to all their family? Can you just take a minute and walk us through that process, please?
Sure. So upon identification of a suspected case, first we collect clinical information from the healthcare provider. We collect the details of their symptoms, when their onset of illness was. We then would go to the individual and ask them about what their potential exposure was to this virus. We want to know if they are a traveler, if they came into contact with a potential case. In this particular situation, because we have been working under a containment strategy where we actually know who a lot of our individuals are who have been exposed, especially around the contact investigation that's been occurring in Grafton County. These people many of them have been under our monitoring anyway, and we're reaching out to them daily, every few days, depending on what their risk was, and are asking them about symptoms. So in that scenario, we've been reaching out to them. If they develop symptoms, we're facilitating the testing for those individuals. And so then if one of those becomes positive, we do the same process where we then ask them about all of their close contacts if they were not in quarantine at the time that they developed symptoms. And then any of their people who have been identified as close contacts, we would then reach out to them, inform them about their contact this individual, inform them that they must also quarantine now, and provide the same instructions. It's an iterative process of informing people that they've been exposed, telling them they need to quarantine, and then asking them to monitor for symptoms, and then we would facilitate testing if any symptoms develop.
If I can also just quickly follow that up by saying, what we have from our public health investigation is a clearly identified what we call chain of transmission, right? Transmission from the first individual to the second individual to now to the third individual, and that's exactly what our public health investigations are intended to identify, with the goal of limiting and preventing further spread in our communities. And so anytime, just to repeat what Ms. Daly said, anytime we identify someone with suspected or confirmed COVID-19, we take the actions of asking close contacts to self-quarantine and evaluate for symptoms to try and prevent further spread of this virus.
I know other people have other questions, but real quick, so take the Grafton County case out of it for a second and look at the Rockingham County case. Okay, that person knew that they were in Italy, but it's kind of a needle in a haystack, basically. You don't really know how many. They could have gone to the coffee shop and sneezed. They could have done any, how do you narrow that down?
Yeah, so that's part of the investigation that we do. We have extensive conversations with anybody diagnosed with COVID-19 in order to identify situations that may have exposed the public or put individuals at risk. And when we have information to share on those investigations, we will share it. Certainly, we will be reaching out to individuals that we identify who have had direct contact with someone positive for COVID-19 to make sure that they're not in the public space. So, other question?
Yeah, I just would like to add that this process of our contact investigation is what we do every day. We conduct over 8,000 investigations for all types of infectious diseases in the state that are reportable to us, and so this is the bread and butter of public health.
Yeah.
Holly Raymer and then Jason.
Just to clarify that chain of transmission from the first to the second patient, can you say whether their close contact happened at that event in White River Junction or elsewhere?
We're not going to get into the details of the timeline here. Again, we're still actively investigating, but what I can say is that these new detections do not indicate wider spread community transmission. We can trace contacts from the first case to the second case to the third case, and the goal of our public health investigation is to try and prevent wider spread community transmission.
And just one follow-up. You had said earlier in the week that a handful of people who were at that event have been asked to self-quarantine. Can you say how many, if at all, staffers at Dartmouth-Hitchcock Medical Center have also been asked to self-quarantine because of close contact?
Can you clarify what event you're referring to?
Not event, but since the first two are workers at Dartmouth-Hitchcock Medical Center, the hospital earlier said it was reaching out to determine whether there were other staff members who had contact. I'm wondering if any of them have been quarantined.
So I would defer you to, with questions about Dartmouth-Hitchcock employees, to Dartmouth-Hitchcock. What I can say is that overall in the state as a whole, there's just over 100 people that we are actively monitoring through our public health agency. But we have not broken down those numbers by employees versus travelers, and I don't have those numbers with me today.
Dr. Chan, we have new updated information on the number of individuals who are under monitoring. Beth can answer that, but just based on what we announced last night.
Thank you. So the current number of individuals that we are that are under public health monitoring is approximately 150. We are saying approximately because this number changes at every moment, part of the day, because people come on our list and come off as they reach their 14-day period. This includes both travelers that we've been monitoring as well as people who have been identified as close contacts to cases.
Jason?
Can you tell me, with the third Upper Valley patient, were they successfully identified as a close contact of the second patient, or did it come as a surprise? Were they off your radar?
So the question was, so the second individual who we had identified in New Hampshire and has now been confirmed at the Centers for Disease Control and Prevention was an individual that was identified as a close contact of our first case. And when they developed symptoms, we got them in immediately for testing and had that individual in close household contact self-quarantine or stay at home.
But with the newly identified patient, was that person on your radar as, had you already asked them to be self-isolating? Were you expecting them to perhaps have it, or were you surprised at this person?
So the most recent individual from Grafton County came to our attention when they reported to us developing symptoms. And so at that time, we reached out and asked that person to isolate themselves, stay out of the public place while we initiated testing. Unfortunately, the test came back positive yesterday. It's hard to get into more detail than that at this point because we're still investigating.
I guess just the question I'm trying to ask is, was the contact investigation of the second patient successful in identifying this person as someone to watch? Is that something you can answer?
So what I can say is that we were aware of the potential exposures at the church. The individual was not under self-quarantine or told to stay home until they actively developed symptoms. But again, it's hard to get into the exact timeline of this because we're still actively investigating. Yes.
Mia Hampton from the Denver office. So the individual.
Jake, John Gregg at the Valley News.
John, we'll be with
when
you.
Did he start?
Go ahead, John. We'll be right with you, John.
When did he start?
I'm sorry. Another reporter is already asking a question. I'll get to you in a second, John.
Sorry.
No, that's okay, it's hard to hear on the phone, go ahead.
So the first individual, the person out of Grafton, the person they contracted COVID-19 from, that individual already was symptomatic and came to health officials with concern before they went to that church social? Is that, you understand?
No. So, and again, I'm pausing here because it gets confusing, and I want to avoid too many details. But the exposure that we believe happened at the church on March 1st occurred shortly before our second case developed symptoms and was brought in for testing. And so I want to stress again that the church and the individual who was at church did nothing inappropriate. The church has acted appropriately and proactively when they found out we had identified someone symptomatic in the community that we wanted to test. They acted proactively to cancel church services for today in order to try and limit further transmission.
I think what we're just trying to figure out is that person, the first person, didn't know they could potentially be infected. Right?
Correct. The individual that was at the church service on March 1st at that time did not know that they were infected with COVID-19. They had, the church service was just before they had developed symptoms and had not been identified for testing at that point.
Just one follow-up question. Do you find, and this would be for any of you, do you find that the length of time that it takes to get results back from the CDC is problematic in that, you know, it had been several days after when the test results came back about the first person, and in that time, would there be potential for that person to infect other people? And would more rapid testing measures be more effective for identifying people who do have this virus and then preventing further spread of it?
So up until a week ago, all the testing that was performed in New Hampshire was performed at the Centers for Disease Control and Prevention. And there was a delay between when we received the specimens and shipped them to the Centers for Disease Control and Prevention for testing and when we got them back. On Monday of this past week, so about 6 or 7 days ago, our public health laboratory in Concord, New Hampshire, brought on COVID-19 testing. And so we can now much more rapidly facilitate testing on residents of New Hampshire and people that we identify that need testing or we recommend for testing. And so it can take up to 24 hours from the time that we receive a specimen for our public health laboratory to run that test. That is a much more rapid turnaround time than shipping to the Centers for Disease Control and Prevention. So that testing capability at our public health laboratory has greatly facilitated the rapid testing and identification of individuals in our community who may be symptomatic and have concern for COVID-19 infection. I will also mention that a number of reference laboratories around the country are now bringing on COVID-19 testing. There have been a number of media reports about that. And so testing will be much more readily available currently and in the coming days for providers in practices and hospitals to be able to get patients tested if they identify symptoms consistent with COVID-19 and have some concern for exposure based on potentially travel history.
All right, before we turn to the phone, any last questions within the room? Tony, one more?
So, yeah, no, just on the 8,000 investigations, is that a day, a week, a month, a year?
I'm sorry, that's a year.
Thank you.
Okay. All right, we're going to turn it over to reporter, to media on the phone. John Gregg, you were first, so go right ahead. John Gregg, Valley News.
Yeah, thanks. Couple questions. How many people attended the church service last weekend? Is there any connection to the Vermont case that they've reported with any of these New Hampshire cases? Are you going to do more remote testing with that truck you had at the airport? And finally, you said you referred us to DHMC. DHMC keeps referring us to you. Could you guys stop hiding behind each other and tell us how many people are being quarantined or affected at DHMC?
Yeah.
Thank you.
So Ms. Daly has already released the numbers of people around the state that are undergoing public health monitoring. I don't have the numbers specific to any one location or investigation, and those numbers, in fact, are constantly changing. You had a number of questions there, so I'm going to try and remember all of them. We have been in contact with the Vermont Department of Health about their announcement late last night as well of their first presumptive positive case. There does not appear, or the Vermont Department of Health does not believe, based on my discussions with them, that there is a connection with our investigation or cases in New Hampshire. And yeah, the question was about the mobile testing. We have been working with volunteer medical providers to stand up a mobile testing clinic that is able to do or collect samples for COVID-19 testing around the state. We trialed this at the end of last week successfully, and we are working with them to have additional sampling clinics so that we can help offload the burden to our healthcare systems and prevent patients that may not be sick enough to go in for medical attention but might need testing for COVID-19 to be able to support the hospitals and community providers to do some of the sample collection, which we can then test at our public health laboratories. I believe there's
How
another...
many people were at the church last week? That's a basic question.
Yeah, so thank you for that question. We've been in contact with the pastor and believe the number to be approximately about 60 individuals who were at the service last Sunday, March 1st.
Sorry, 1-6 or 6-0?
60.
Thank you.
Any further questions from media on the phone? Okay. Any final questions?
Do you have any thoughts about whether the state should continue a town meeting or declare a public health emergency?
I'm going to let Ms. Daly answer that. I'm not sure what town meeting you're referring to.
Town meetings are March 10th.
Oh.
No, well, the elections.
So under state law, there is no declaration of a public health emergency. There is a declaration of a public health incident, which Commissioner Shibinette has already declared, which enabled our ability to utilize volunteers. In regards to the question was whether we would do anything around town meetings. Sorry.
Right. What about gatherings, town meetings or otherwise?
Sure.
What are you recommending to people around the state? Should they go?
We are not making any recommendations around mass cancellation of events at this time. We have been consulted on specific events in our communities, and we have been providing recommendations around some of the prevention measures that Dr. Chan has already outlined. I think we can work with individual communities that may be concerned and consult specifically about certain events, but at this time we're not recommending cancellation broadly of any events. Yep, Dr. Chan would like to say more.
I want to emphasize again that we have 4 individuals in New Hampshire with identified COVID-19 infection. These individuals are either travel-related or we can trace their exposure back to another person who has been diagnosed with COVID-19. So we have not identified broader community transmission at this point. That is certainly it's certainly possible that in the future we will see further spread of this virus around the country and even possibly in New Hampshire. And at that time we will take the appropriate steps and precautions to protect our communities. We have the ability to recommend cancellation of events, but we're not taking that step currently based on our investigations and the information that we have right now. We certainly understand the concern that communities will have, but we do not want our communities to panic. We want them to feel like they can go about their everyday activities, but do want to stress that people have increased or heightened awareness to the situation and take precautions to prevent transmission of potentially COVID-19 or other respiratory viruses like influenza, as we've already discussed. So I want to emphasize again that it's important for people, if they're not feeling well, if they're feeling ill, that means if they have fever or respiratory illness, or if they have mild flu-like illness, to stay home and avoid public places to protect others around them in their communities. It's important for people to practice good and frequent hand hygiene and frequently disinfect frequently touched and contaminated surfaces, and to practice basic social distancing measures to avoid further transmission of viruses in their communities.
Dr. Chan, can you give us an update on testing capacity? I think the daily update the other day said we have 200. The CDC sent new tests that allows to test 200 more people What is that in addition to? What's the total number now of people we can test?
So we have, as of the middle of this week, we had the capacity to test approximately 200 individuals at our public health laboratories. There are close to 50 people, so between 40 to 50 people that we have tested already. So we currently have in our public health laboratory the capacity to test approximately 150 additional people. Those are approximate numbers. We are constantly evaluating the testing capacity and the situation, and I know that the Centers for Disease Control and Prevention and federal HHS is working to increase testing capacity at our local and state public health laboratories. I will also mention, though, that testing capacity is expanding through normal medical routes as our reference laboratories and even hospitals around the country work to bring on testing for COVID-19, so we expect capacity to only increase in the coming days.
Do you know when you might get more test kits from the CDC?
I'm not clear when we will get more test kits from the CDC.
Okay, that has been
Yeah,
today's.
hello?
Oh, sorry. Go ahead. One last question.
I have a question.
Nancy West.
Nancy West, indepth.nh.org. I'm a little confused about where these cases started, et cetera. Now, the first one, it appears, was through traveling in Grafton County, and the second one had contact with the first person. Now, this third person, is this also connected? Does this third person work at Dartmouth-Hitchcock Hospital as well?
So we are limited in our ability to release detailed information like employment for these individuals. What I can say is that the first individual. I'm sorry. Can I answer, please? What I can say is that the first individual in Grafton County was travel related to Italy, as we already announced. The second individual in Grafton County was an identified close contact of the first individual. And the third individual, now announced from Grafton County, is an identified close contact of the second individual. So I don't want to get into too many details and specifics of the timeline, but as I mentioned, we can identify through our public health investigation a clear chain of transmission for these cases.
Go ahead, Tony.
Yeah,
Yeah,
could
no,
you
so
tell me
let-
what precludes you from identifying where this person worked, where the other two have already been identified as employees?
Yeah, so we did not and have not released information about their place of employment. We don't typically do that with our public health investigations. That information was released through other sources.
Just real
Yeah,
quick.
step up. This
Well, I
is an
don't think this
epidemic.
is a
Does the guy
typical-
work at Grafton at DHMC or not? The third person.
We are not
This is
releasing
an epidemic.
employment information of our individuals.
I'm sorry, can I
Yeah.
ask something that's similar but not specific? So,
Yeah.
you've been really great about the privacy. The last thing I would want is anybody saying the patch editor contracted, whatever, right? I get that. Dartmouth-Hitchcock was really open about announcing the first one. When does the state get involved when there is a situation, hypothetical, I'm not saying that the third person is a Dartmouth person or a Concord Hospital person or anybody else, but when does the state get involved where, okay, organization A, you need to be a little bit more open to people around you about how this process happened, especially when we find out that the first person maybe
Yeah.
being not really
Dartmouth.
cognizant about what they were doing, made a decision not to listen to all of you and potentially endanger other people. When does the state get involved?
Yeah, so we work very closely with our community partners, including hospitals, when we conduct these investigations. And oftentimes we're in the situation where we're releasing information as well as the organization is releasing information, and we try to do this in a joint and coordinated process. What I can say is that it's of utmost importance to us that we protect the privacy of individuals that we're investigating, so that there is not anger and potentially backlash against these individuals. That's something we take very, very seriously, and why we go to great lengths to protect the privacy of individuals who may be tested or diagnosed with COVID-19 in this particular instance. But we are limited in terms of the amount of information that we can release. But we work very closely with our community partners to identify people that may have been exposed and susceptible so that they're not posing a risk to public health. I'm going to let Ms. Daly comment.
And at the same time, we take our mission to protect the public very seriously. So as we describe the process of contact investigations, when we identify close contacts, we do personally notify them of their contact. If we encounter a situation where we are unable to identify with certainty the people who have been exposed, we will do a community notification, as we have done in this situation by identifying the church. And that's how we will move forward. So as we conduct our investigation around these two new individuals, if we were to identify, for example, a workplace exposure, and it involved the public where we could not with certainty be able to notify every individual who would have had close contact with that person, we would move to a public notification. So we take very seriously our obligation to inform those people who have been exposed so they can also be protected.
And that's consistent with
Well, I
what we've
would
done
think
in
that
this.
people-
And that's consistent with what we've done in this situation by announcing one of the locations that we're aware of, a public location where there may have been exposure in the church community.
We've done two, we did the Vermont,
Yes, the
Oh,
ending row as
correct.
well.
And, you know, we've done that with the function room in Vermont as well. Yeah. Thank you.
Very much. All right.
You know, I have more questions, so please don't end the press conference.
Nancy, do we have time for one more question?
Okay, I understand the reasoning behind protecting people's names. I think it's in the public interest to say not only where they work, but the town or city where they live. Grafton County is a big place, so is Rockingham County. How is someone's privacy going to be exposed if you say where they work or the town they live in? Town meeting's coming up. If a person at home under the care or whatever it is from public health department, I think that name of the town should be released. Are you going to release those towns and where the person works?
So we understand that there's.
As far as I know, HIPAA only protects names and identity.
Go ahead, Beth.
Thank you for the question, and certainly we understand that people would like us to provide as much information as possible. There are specific provisions in HIPAA that outline a number of different variables that they consider as potentially identifying, and they use constructively identifying, which means that if you release enough information, people can figure out who this individual is. And one of those is a geographic definition around zip coding, and that we are complying with these definitions that have been provided by HIPAA. Again, when we will release information that does not that is outside of those parameters if we feel it's necessary in order to protect the public, and we have done so already.
And can I make just one last statement, and then we
You haven't gotten into
can.
very much specifics about the Rockingham County case.
So.
Are many of does that person have a lot of contacts that you have reached out to?
Nancy, Dr. Chan said at the beginning, this is a new investigation. We're just learning these details. We will have more information as we know it and as it relates to protecting the public's health.
Yeah. So let me just,
can you
in
please-
closing,
There
make.
are 8,000 people who work at DHMC in their clinics. Can you rule out the third person from there or not? There's no way that that's going to identify him specifically. Yes or no?
We've made it very clear what the information that we're are providing at this time and allowed to provide under federal privacy statutes.
So let me just say again that this is an active area of investigation. We want to both not only protect the privacy of individuals during the process of our contact investigation, but also alert the communities involved when there is a significant public exposure that requires action, and we have done so in this case, and we will continue to keep communities updated with important and actionable information as our investigation progresses. So thank you.
Okay.
When you rule them out, so how does it,
Thank you,
if I had
John.
to be work for the New England Patriots, you'd rule them out, right? So
Thank
does
you
it
for the
work there or
questions.
not?
Thank you for the questions, John. This concludes, that question has been addressed. This concludes our press conference for today. Thank you for hanging up, John. We will be providing updates on additional briefings, or whoever hung up, excuse me. We will be providing additional information for media regarding updates in the coming days to reconvene and address your questions as we have them. Look for more information from the Public Information Office of DHHS. Thank you all very much for your time. Have a great Sunday. Bye.